one of the things that I learned in the conversation is that, well, we were concerned at our table of what clinical information is provided to the laboratory at the time they do the gene testing, whether it's for hypertrophic cardiomyopathy or long QT syndrome or whatever. And it was clearly pointed out that there is a website, and on the website you can download the clinical form, and one can provide the clinical, and should provide the clinical information, which dramatically improves the likelihood of the validity of the test. And in fact, if one can provide the electrocardiogram, et cetera, that's all very important. And it seems to me that there are inherited arrhythmia clinics that are springing up all over academic centers and large non-academic clinical centers, and that this is a resource where if one wants a genetic test, that one should provide the clinical information. This dramatically improves the precision of the test and the likelihood of interpreting the test properly. And since I was not asked to talk, this was purely spontaneous, I'm going to ask Sylvia Priori to say her comments on this area, and I'm also going to ask Barry Maron to say the similar thing, whether it applies to hypertrophic cardiomyopathy. But this is unprepared. I haven't asked Sylvia to talk, and nobody asked her to talk, but I would be very interested to know how much she thinks the clinical information improves the precision of the ability to test, if you would just say a few words.
Sorry, completely unprepared. I was relaxed, enjoying my chocolate cake, and here I am. Which was the question?
Well, the question is, how much does the clinical information that's supplied to the laboratory help in the precision of the accuracy of the diagnosis, basically?
Yeah.
You haven't had too much wine, have you?
Wine and chocolate, because I was relaxing. You know, I presented my case, and I thought, I'm done for the day. No. Okay. I think that here we have seen numbers like less than 6% of the identification of mutations of unclear significance. I think that probably, as they correctly speculated, is an optimistic view because the population is referred by centers who select and send in for diagnosis patients with a clear long QT syndrome. I think that as we go more in testing of patients with possibly long QT syndrome, but not necessarily clearly on the electrocardiogram, we will see the increase of these uncertain forms. And here is what the point of Arthur becomes very important. Two things are critical: getting more family members and getting the electrocardiogram, because the minute you could say that maybe the person screened had a borderline QT, but then you have someone else in the family with a clear long QT and that mutation, you can attribute more significance to that mutation. So I know that physician says it's not practical to send all the information because in the clinical setting, the nurse is filling the form and the nurse doesn't know the QT because the QT was measured by the cardiologist in another room and all things like that. But I think that I absolutely agree with Arthur that if it's possible to try to send in more information, and even more if it's possible to try to collect the family members and motivate the family to be tested, that definitely increase the amount of information that as a community we have through the companies, through our own databases. It doesn't matter. Eventually all these will have to become public, in the public domain, and try to help us reduce the number of mutations that we don't know what they mean. I think I've seen that the patients get very frustrated when they get a result that says, you know, you've paid out of pocket your money, and you have been hoping for 6 weeks that finally we could tell you if the disease is, you know, LQT1, LQT2, LQT3. And sorry, we don't know if the child is affected, so since we don't know, we keep the child on beta blockers. And that, you know, is a burden on the family, and we really need to have, as a community, the commitment to try to fill that gap. So I think that these are good reasons for trying to send in the information. Have I done my homework?
You didn't even go back to the chocolate cake.
Thank you.
But I'm going to ask Barry Maron, because I think hypertrophic cardiomyopathy may be a little bit different